Today we're going to do 12.5, which is health insurance, okay? Health insurance is basically provides for financial resources to meet your cost of medical care, okay? And your loss of income due to your sickness or injury. There's another type of insurance, which is disability income, and that is insurance for the loss of your income, okay? Now, we're going to go ahead and talk about the three different ways that you can get health insurance. And the first one is through private groups. That would be like your Blue Cross Blue Shield group. Okay, then you also have Medicare, which is your Social Security, which comes from the federal government. And the last way is your workers' compensation, and that's provided by your business, okay, for injuries that happen while you're on the job. Now, medical expenses are classified by three different types of coverage, basically. The first one is your basic medical coverage, and that pays for your hospital, your room board, your surgical procedures, laboratory fees, x-rays, a whole list of different things here. With basic medical coverage, you tend to have a copay and a lower base limit. So if you get in an accident, if your bills get too high, you might reach a point where your insurance will stop paying because you've reached that limit. Okay, so because of fear of that, some people go on and get major medical coverage, and that is for large medical expenses with traumatic injuries from accidents or long hospital stays. And this has a really high limit. The limit is over $1 million possibly, okay? But the thing with this is it has a high deductible for it. And you have co-insurance provisions, which mean that the deductible is met, the insurance will pay a percentage of it, okay? So that's the difference with major medical. The thing is, remember though, it has a really high copayment for it. So we have what is called comprehensive. And comprehensive is that medical insurance program that combines the two, basically. It has your basic program along with your major medical. And the thing is, it tends to have a lower deductible, but it has a higher limit for major injuries or long hospital stays. And it doesn't have normally a co-insurance where once you meet, you have to pay a certain amount. So comprehensive tends to be a way a lot of people get their insurance because it's a good mix of the two with having a lower cost. So let's talk about a deductible, okay? You've heard me say that a couple times. What is deductible? And a deductible is the amount of money that you have to pay per year for as the insurer, okay? And so that deductible is per person. So let's say you have a $500 deductible. If it's just you, you're only going to pay $500 a year. But let's say you have a family of 4, you're going to take that $500 and multiply it by 4. So your family out of cost pocket is going to be $2,000 a year for this deductible. Then once you meet that deductible, then you'll have your different benefits that are applied to your insurance. Okay, so let's tackle this and start getting into examples. But first, there's two things that if you haven't done your reading, and that you need to in your book, they pick up on a few things here. And on page 469 in highlighted bold print are these two things here, okay? When we're doing our homework assignments, we're going to figure that all of these incidents that are happening are at the beginning of the year. And that means that we have not met our deductibles yet. So we have to use our deductible payments. Now that deductible, we're going to go ahead and we're going to either apply it to the doctor's bill or the surgeon's bill. Okay, and so what that will do is reduce the amount that the insurance company is going to pay on the surgeons because you've already paid the deductible portion. So it's important that we use that. Also, before we begin, let's take a look at the table that we're going to use. This is on page 469. On this table, 12.5, you have your three basic plans, okay? The basic, the major medical, and the comprehensive. Down in the center here, it describes what's going on, and basically it lists your deductible of what's going on. So basic, you have your $500 deductible. For your major medical, remember we said it's a high deductible, and here you see it. It's $2,500 for each person. Okay, and then once you meet it, it's an 80-20. So basically, the insurance will pay 80% of the bill, and you're going to pay 20% of the bill. Okay, then comprehensive. Comprehensive says you're going to pay the $500 per person for the deductible, and anything that is over a $30,000, you're going to go ahead and you're going to pay this 80-20. So the insurance company will pay $30,000 of the bill. Anything that's left over, you're going to be responsible as the insurer for 20% of it. The insurance will pay 80%. Over here is your maximum claim. So how much will they pay for each thing? How much will they pay for a hospital room and surgery procedures? So you're going to need to make sure you are looking at the correct plan and what they cover. Also down below here, you have some fine print that you're going to need to read to know how to do your problems. Okay, so let's get into the examples here. The first example we're going to deal with is basically a straightforward plan here. We have Rachel. She's in a car accident. She has a claim for her hospital stay in that, and for the surgery. It was $8,500 for the surgeon's fee, and the hospital fee was $28,196. We want to know how much she's going to have to pay personally for this. It tells us at the end that she has major medical insurance. So you're going to be looking at that middle row where it talks about the major medical. And by looking at the chart, we can tell, remember, this is the one with the really high deductible. Her deductible is $2,500. Okay, so what we're going to do is remember our deductible is always taken off from our surgeon fee or our doctor fee. So we're going to take that $8,500, subtract her payment of her deductible, and then this is what the insurance is going to pay, is $6,000 for it. Okay, then what we're going to do is find out how much all of this is together in claims. So we have the $6,000 for the surgeon fee, and then we have the hospital fee for $28,196. Add that together. And then, remember, this is where we have the 80-20. Okay? So what we're going to do is, now that we have our total amount, we're going to have to find out what her portion is. And she's paying 20%. So that would be 0.2. Times it by the $34,196, and we see that she's got to pay $6,839.20 for this hospital stay. Now, we also, though, to that, have to combine her deductible that she paid. So for this car accident, her stay in the hospital, her bill for this is $9,339.20. Okay? Now, let's go ahead and we're going to look at example number 2 up here. Okay? Example number 2 is for Rob, and he has surgery and he has basic coverage. Our basic coverage is a lower deductible, but it doesn't cover as high of a claim. So this lists all of his expenses for his time in the hospital. And now what they want us to do is find out what his cost will be. So you've got to look on your table on page 469, and it says a $500 deductible per person. They will pay $30,000 for a claim. They will pay, as the insurance, they'll pay $900 of the hospital room and only $15,000 for the surgical. So we're going to have to work our way step by step and find out what his cost is going to be. So the very first thing we're going to work with is his deductible. Remember, the deductible comes off the surgeon's bill here, down here at the bottom. And so we're going to take our $10,600 and subtract the deductible, and this is what the insurance company is going to pay. Okay, then the next thing is we're going to work with our hospital room. Now, remember, his hospital stay is $1,023. That's more than what his insurance is going to do. So we're going to take that cost of the room, subtract what the insurance is going to do, and we have $123 over. This is what he is going to be responsible for paying, $123. He's in the hospital, it says, for 10 days. So we're going to take that $123 times 10, and this is Rob's cost for staying in the hospital. Okay, this is what he's responsible for. So I'm going to kind of underline it so that I can recognize this is what we have to add together at the end, so I can find it easy. Okay, the next thing I need to go ahead and do is find how much the insurance is going to pay for the surgery. Okay, so remember, the insurance says they're only going to pay $15,000 for it. His bill for the surgery was $15,680. So we're going to subtract it, and we find that Rob's going to be responsible for $680. Okay, then we're going to keep working our way down, and we're going to find out how much all of the costs that the insurance company has to pay. Okay, so we have $900 a day that the insurance will pay. He was in there for 10 days. The insurance will pay $15,000 for the surgery, and it will pay $3,500 in the hospital charges that he has, okay? So that's part of the insurance. So we're going to add that all together, and you get $27,500, okay? And so remember, we're going to add up all his costs and the deductible to see how much the payment is going to be. And that's $37,600. Okay? Now, sorry, that $27,000, that $10,000 came from up here. Okay, not the deductible. And so that was the cost minus the deductible. This is how much the total bill for his surgery was. Now the insurance company will only pay $30,000. So Rob is going to be responsible for the $7,600. Okay, so now to find out how much the surgery cost Rob, we're going to have to add up all those things that we underlined. So we have, starting at the beginning, he's got $680 for the surgery cost, okay? He's got $1,230 for his room. The $500 is his deductible, and then this is the extra cost left over from all what the insurance will not pay. Add that all together, and this is what $10,010 is what Rob is going to pay for his surgery. Okay, so we have to take everything piece by piece, looking at what the costs are, and then comparing it to what our table says. And I suggest keeping that table right beside you as you do your homework so that you can look back and forth on it. Okay, so let's do one more example here. Okay, and this is for Alex here. He's got a hospital stay that was under his comprehensive plan. Okay, so right now it told us what type of plan he had, and we know that it's less than what their limit is. Okay, so we're good with that. And so then they list us the fees. Okay, so kind of like what we just did for problem 2, we're going to have to work our way step by step. Now, they want us to find the cost to Alex and the insurance company. So for this one, we're going to need 2 answers for it. So starting at the beginning here, okay, we're going to start with our deductible. Okay, looking at comprehensive, our deductible is $500 per person, and it always comes off the surgeon fee or the doctor fee. So we subtract that, and this is what this is basically what we changed guy. This is Alex pay, and this is what the insurance is going to have to pay. Okay, so let's move on to the next thing. Now we're going to find out the amount to find the claim billed by the insurance company. So this is what we just found out is the insurance paying for it. And under our plan, they will pay the physical therapist for its amount and the hospital stay. Okay, this hospital stay includes $983 a day for room and board and for 63 days. Okay, so that is where that total came from. We're going to add that all up, and that's the insurance total that they're paying here. Okay, now for this, we're going to take this grand total, this $90,000, and we're going to subtract the $30,000 for it, whereas it says it pays for the amount. What is left over is this $60,859. Now, looking at a comprehensive, remember anything that was over the amount of, we're going to do the 80-20. So our insurance company is going to be paying 80% of that $60,000, and once I multiply that together, I find out $48,687.20. Alex, his portion is going to be 20% of that, which is $12,171.80. Now, the last thing is to Alex's portion, we have to add the deductible. So we're going to take that $12,000 plus the $500. Remember, he had for his deductible, and that is his portion. Now, to find the insurance company, we take the 80% plus the $30 that the insurance said that they would pay in the plan, add that together, and that's what the insurance company is going to have. So we're going to follow the plan and follow the chart telling us what type of coverage that they will have. Okay, so we're going to take a look here quick at the different problems you will actually have in the book. So problems 1 through 4 in your textbook, they want you to find the instruction says there's no deductible and the coinsurance is 80-20. Determine what the insured individual pays for the charges. So basically what they want you to do is find out what is 20%. And in the assignments, they give you the final total. So like for problem number 1, it's $10,240. You're going to take that total and multiply it by 0.20 to find out how much the cost is going to be. For problems 5 through 7, they basically said the insurance is giving you $10,000 that they will spend on the hospital room. Okay, and then they give you for like number 5, it's $900 a day. So they want you to figure out how much can you spend, how many nights in the hospital until you reach that max of $10,000. So simply, you're going to take that $10,000 and divide it by the cost, and that will give you a day, the amount of days. Now remember, you can't round up because you'll run out of money. You've got to round down. Okay, problems 8 through 20, those are basically looking at the examples 2 and 3 in your notes and working your way step by step, looking at the plan and looking at the problem of what the costs were. If you got any questions, text or email me. Have a good day.